So I also understand that one of your specialties in pain management. For the literal person and myself, just for the benefit of my audience, when I think of pain management, I think having a headache, going to buy some paracetamol, uh, Tylenol, ibuprofen, aspirin, and the likes to manage the pain. What is it uh, that goes into pain management that requires it to be a specialty?
So pain management is a medical specialty that trains people to be good at diagnosing and treating patients with persistent pain. And when I say persistent pain, I mean pain that has been going on for weeks, months, and even years. So we diagnose a patient and we use different techniques to manage the pain and restore comfort and function in the patient.
Okay. So, what are some of the treatments that you give for such pain management? I'll presume that these patients will be beyond taking just paracetamol and resolving their pain. They require something more intense than that. So, what are some of the uh, procedures? I know you can't go into detail, so just briefly summarize some of the things that you do to manage some of this chronic pain.
Well, there's really no particular template that we use to manage pain. Everybody deals with pain differently. Pain is unique it's unique per the person. Um, so we use a multidisciplinary approach. Sometimes we use conservative measures, which involves just um, like physical therapy, massage therapy, and the likes. Sometimes it also takes using medications. So we have different kinds of medication that we can use to uh, target the pain generators. Um, and sometimes too, it does require using procedures. There are several procedures that we do, including injections. Sometimes we do spinal cord stimulation, peripheral nerve stimulation, and sometimes it also requires implantation of a pain pump where we infuse pain medications directly into the body, close to the spinal cord, and various other procedures that we do. And sometimes it's just a combination of all of those. The pain usually starts up here. It's interpreted up here. It starts somewhere in the body, but ultimately the brain has to interpret the signals as pain. So sometimes we also have to target the brain itself using a psychological approach to treat it.
Well, so it looks like pain management in itself is a very well needed specialty, given the explanation that you've given. And I know you're going to be of good service to the people of Ghana and almost to West Africa as a whole and